Good evening. The second nurse in Dallas diagnosed with Ebola is Amber Vinson, who was among more than 70 workers at Texas Health Presbyterian Hospital who treated Thomas Eric Duncan, who died last week. Today, Vinson, in the yellow suit, was put on a plane to Atlanta for treatment at a specialized infectious disease unit at Emory University Hospital. Unfortunately, this is not her first flight this week. Monday night, as she was becoming ill, Vinson flew commercially from Cleveland to Dallas with 132 other passengers. President Obama canceled his schedule today to hold a special cabinet meeting on Ebola.
What we've been doing here today is reviewing exactly what we know about what's happened in Dallas and how we're going to make sure that something like this is not repeated and that we are monitoring, supervising, overseeing in a much more aggressive way exactly what's taking place in Dallas initially, and making sure that the lessons learned are then transmitted to hospitals and clinics all across the country.
The president also said that the CDC will set up a SWAT team to reach within 24 hours any hospital reporting an infection. He said the threat of an actual outbreak in the United States is, quote, very, very low. But he warned that if the world doesn't end the outbreak in West Africa, then Ebola will spread globally. We have a team of correspondents on this story from Dallas to Liberia, and we'll begin with Manuel Bojorquez.
Officials say the nurse, 29-year-old Amber Vinson, was isolated at Texas Health Presbyterian within 90 minutes of reporting a fever yesterday. But just the night before, she was on Frontier Airlines flight 1143 from Cleveland to Dallas, and she boarded knowing she had a low-grade fever of 99.5, according to CDC Director Tom Frieden, who spoke on a conference call this afternoon.
The healthcare worker number 2 should not have been allowed to travel by plane or any public transport by virtue of the fact that she was in an exposed group.
Officials are now trying to track down the other 132 passengers, though Frieden says their risk of infection is considered extremely low. Vinson was diagnosed just 2 days after her coworker, 26-year-old Nina Pham, increasing concerns about the hospital's ability to treat and contain the disease. Here's what State Health Commissioner David Lakey said 2 weeks ago.
This is not West Africa. This is a very sophisticated city, a very sophisticated hospital. The chances of it being spread are very, very, very small.
But today, senior hospital official Daniel Varga said this.
We're a hospital that may have done some things different with the benefit of what we know today.
Both nurses cared for Thomas Eric Duncan September 28th through the 30th, a time when doctors say there was extensive contact with vomiting and diarrhea, and now believed to be the period when the risk of infection was highest. Dallas County Judge Clay Jenkins says there are no plans to quarantine 75 other healthcare workers who were possibly exposed while treating Duncan.
If they have any temperature or any other, loose stool or any other symptom, they immediately go to isolation.
Mayor Mike Rawlings indicated there could be more cases.
It may get worse before it gets better, but it will get better.
In Vinson's Dallas neighborhood, hazmat crews began decontaminating her apartment. Emily Gieselin lives nearby.
It was just a little nerve-wracking, not gonna lie. Just like, okay, is this gonna keep going? There's gonna be more and more and more, and so, when's it gonna stop, I guess?
The CDC says Vinson was never told to stay off commercial flights. Officials in Ohio say she visited 3 relatives there who work for Kent State University. Scott, those family members have been ordered to stay off campus for 21 days as a precaution. And tonight, the first nurse who contracted the virus, Nina Pham, remains here in good condition.
Thanks, Manuel.